Call the meeting to order today for House Welfare Reform Committee, and on Thursday, January 25th. And I am filling in for the chair. Obviously, I am not Representative Camp, but he's feeling under the weather, so I am substituting for him today. So if you all have some grace with me, I would appreciate it. So we're going to start off today with bill intro requests. Does anybody have any bill introductions that they would like to do, either from the committee or the audience? All right, so it doesn't look like we have any, so we're going to go ahead and move forward. Do we have, yes, thank you.
Madam Chair, thank you. I would move we approve the minutes of January 16th, 18th, and 23rd as presented by our committee scribe.
All right, seconded by Representative Droege. Gary, if you didn't hear that, Gary Droege. Droege, I'll get it. All right. So are there any objections to that, committee? Everybody's all good? Okay. So everyone, I guess, vote aye if you're in favor. Aye. All right. Any objections? Nope. Okay. All right. Thank you. Then, okay, so I think we'll just dive right into the main portion of the meeting today. And first up, we have Christine Osterland, and she's the Medicaid Director and Deputy Secretary for Agency Integration and Medicaid, Kansas Department of Health and Environment. That's a handful, or mouthful, I should say.
It takes me 5 minutes to do my name and my title, but good afternoon. Thank you for having me. As she said, I'm Christine Osterland, Deputy Secretary for Agency Integration and the State Medicaid Director at KDHE. And I'm here today to talk to you about Medicaid eligibility and kind of the process as we go through in Kansas, as well as some of our quality control measures. I will start off as we get talking about eligibility and we get into the criteria for Kansas. One thing I want to point out about Medicaid, if you've seen one Medicaid program, that's all you've seen is one Medicaid program. The federal government has lists of populations, they call them mandatory populations, that all states must cover, but they have a whole array of eligibility groups and individuals that a state can elect to cover, and Kansas is very narrow in that. We have very few optional eligibility groups that we cover. So again, I just wanted to point that out, that comparing state to state when it comes to eligibility is really difficult to do, just because the programs look so very different from state to state. So in Kansas, for someone to be eligible for Medicaid, it's really a two-prong authority. First, they must meet financial requirement for the program. That's the first test that is done. And then they must meet a category of eligibility. I've listed on slide, the second slide for you, what the groups are in Kansas. So you have to first be financially eligible, then you either have to be a child, a pregnant woman, a caretaker adult, which means you are the parent or legal guardian of a dependent child, disabled, but that is per Social Security requirements, that is not any other disability designation, or you have to be elderly, 65 and older, or again, that elderly would also cover a lot of our long-term care and HCBS populations. When we process eligibility, the state is required to follow all CMS guidelines. If we do not, and we are found to be in violation of that, we do put our federal financial participation at risk. So I'm going to on the next slide, I'm going to go through some of the things that we verify when someone is applying for eligibility in Medicaid. As I said, they have to first meet a financial and a categorical requirement. They must be a resident of Kansas. They must meet citizenship requirements, and those requirements are verified, as well as residency is verified. Either by an electronic match or a submission of documents, we will verify earned and unearned income. Unearned alimony, child support, retirement, so it's earned and unearned income. They have to demonstrate the resources are within acceptable limits. For example, for long-term care, the amount of resources you can have is $2,000. Again, there are some exceptions, but again, you must meet resource requirements. If you're an HCBS or institutional setting, there's additional requirements around functional eligibility. There'll be a determination that you meet like nursing home level of care for you to receive nursing home eligibility for nursing home stays. You must also reside in an appropriate setting. So for instance, there are certain facility types that we cover, nursing home, assisted living, and there's limitations around those appropriate settings. One other thing I want to point out about enrollment in Kansas is it's right around 2/3 of our enrollment is children. It generally ranges from a low of 60 to 62, high end might be some months 66%. Eligibility, varies month to month, but predominantly our enrollees are children, which would be individuals 19 and younger. So how do we go through the process for eligibility? And this is next slide, sorry. The first thing that we're going to do is electronic matches. Electronic matches were mandated as a part of the Affordable Care Act that was passed back in 2012. The reason for the electronic matches, according to CMS, it should be done to reduce burden on the consumer, but it also decreases processing timeliness. So if I can get an income record through something such as TALKS or what they call the federal hub, which would be like IRS data, and I can validate your income, then there's no need to ask the consumer. But we'll get in later, there's still criteria around what's acceptable and what's not. If electronic matches cannot be done, then that's when we get into paper documents, which we'll talk about. These electronic matches must meet federal requirements. Again, there's only certain data matches we can do. We can't go out just as a state and kind of pick an electronic data source that hasn't been verified as providing accurate and complete information. If paper documents are required, we only ask for documents for things we cannot verify electronically. So if I was able to verify your bank information, for example, electronically, or your income, I'm not going to ask you as a consumer to validate that unless you take exception with it. But I will make you validate citizenship, residency, household composition, whatever I wasn't able to validate through the electronic match. All right, next slide. Once we receive the paper documents, they are uploaded in our system and they are attached to the case as a permanent record. So if there's any need to go back and research the case, or there's, for some reason there's a concern, I'll talk about the Inspector General's office and some of the work that they do gives them the opportunity to look back and see exactly what happened, what documentation was used to make a decision. The eligibility worker, if we do get paper documents, it is an eligibility worker who will be entering that information. That's one of the other reasons for electronic matches. As you can imagine, if I have a system, for instance, work data, and it's automatically uploaded into our system, it's most of the time a one-for-one. If I have a human entering that income information off of a pay stub, there can be a slip of the fingers. Again, we have safeguards in place that they have to do double data entry and things to try to prevent errors, but humans, do make mistakes. The eligibility system, so what happens is after the worker has now entered any of those paper documents into the system, it is actually the system that performs all of the analysis to determine if they meet the eligibility criteria. The system will also maintain a record of any individual who has accessed a case for any reason. So we have an audit trail. So again, if we need to go back, and we'll talk about that in quality control, and we're trying to identify who made the mistake or what happened, there's an audit trail that we can see who touched that case and on what day. All right, the next slide. There's a hierarchical process to how we do eligibility. We've kind of talked about some of this, but I'll kind of talk about it. So we refer to it as tiers. And so what happens in the tiers is it truly is a hierarchical relationship. We will do tier 1 first, then tier 2, then tier 3, and tier 4. So tier 1 is payer interfaces. These sources are considered and verified as highly accurate. Some examples in Florida, the Federal Hub, KDOL, their unemployment data, Social Security Administration, and CAPERS. These are all examples of highly verified electronic matches that we do to try to get income information. If tier 1 is not successful, tier 2 are some other interfaces that we have. This information is still considered pretty reliable, and we will use it. Examples here, we do get information from KDOL on earned income for people working within the state of Kansas. We get information from a system called TALKS, which is earned income data from a national data source. I've got some others listed here, and there's a lot of acronyms, but I did want you to know in your appendix, we've given you a list of every electronic resource that we use, and it gives an explanation of which one, what it is. So like AVS, for instance, is an asset verification system. So once we've done tier 1 and tier 2, if we still have not been able to garner enough information to determine eligibility, we will go on to tier 3, which is research. The main thing we do here on the Medicaid side is the SNAP and TANF programs also use our eligibility system. There is a firewall kind of in between them because we have different criteria for eligibility, but we can go over if someone's applying for Medicaid and they do have a SNAP or TANF case and we're trying to research information, we can go over and look at some of their data. And if it's been in a window of verification, let's say it was verified last month, there's reasons that we can use that when we can use that information. Some of the other things that we'll do is we sometimes will attempt to contact, and mainly here it's a business. When you get into the long-term care side and even some of our just elderly or disabled, they may have burial plans or life insurance policies, and those really influence eligibility. If we're having trouble or the member is having trouble getting us that documentation, we'll call those companies ourselves trying to request that they send us the burial plan or the life insurance policy so we can go ahead and review those and process eligibility. And then finally, tier 4, if everything else has not been successful, that is now when we're going to request information from the beneficiary or the person applying. Again, it will only be the items that we weren't able to verify. And one thing that I want to point out here when we get to tier 4, I've also attached in your appendix a list of acceptable documentation. So we only accept certain types of documents. If we do not receive that particular type of document that we need, that case will be denied. So someone can't, kind of create a letter or something and try to send it to us to, say that this information is correct. If it's a earned income, it would have to be a pay stub, a tax return. So again, we've listed those in the back for you. And also on earned income, it has to be the last 30 days. Because again, we all know that you can switch jobs and your income information can change pretty quickly. All right, next slide. We're going to go on to the eligibility verification timeline. Kansas does have continuous eligibility requirements for some of our population. These apply to children under the age of 19, pregnant women, and adult caretakers. So what does continuous eligibility mean? It means that we verify all their information at the time they apply, and they get 12 months of continuous coverage. I'm going to cover in a minute some exceptions to that, but that is the rule, that they would primarily get 12 months of coverage. Part of the reason the pregnant women are in that group is a few years ago, I believe it was in 2022, the Kansas Legislature did expand postpartum coverage to 12 months. The legislature made that decision. Providing continuous eligibility to children is required by federal law. All other adults, like I said, if you are not a caretaker, then you are not subject to continuous eligibility requirements. Negative action can be taken on these individuals, but the one thing I will point out here, most of these adults are disabled, HCBS, long-term care. The likelihood that they have changes in circumstances throughout that 12-month window is pretty small. This is probably the one population that year over year, their information is pretty consistent because obviously they're in some type of setting, nursing home or community-based care setting. The next slide about timelines for eligibility. During the public health emergency, Kansas did not stop running renewals. I think there's been a lot of confusion. I think there were states that did. I will say that. Kansas was not one of those states. What changed under the public health emergency for Kansas is if we could not verify electronically that you met the requirements, we could not end date your eligibility except in certain circumstances. But what we did is we would push their eligibility forward 4 months. If I could verify you through all the electronic matches that you still met the criteria for Medicaid, I extended you for a year. And the reason we did those timelines was that would mean that when the PHE ended, as it did last spring, the first 4 months were going to be heavily weighted to those individuals that we could not determine their eligibility absolutely during the public health emergency. So the first 4 months that we went through unwinding in Kansas, that was our highest volume of reviews that we did, and primarily the reason was because we had front-loaded it with these individuals, so we had an opportunity to send them a notice to say, you need to go through your review process and we need to determine if you're still eligible for Medicaid. So we did those groups April, May, June, and July. So those individuals have all gone through their renewal process and we have determined whether they still met requirements or not. All right, now we're going to turn, next slide. We're going to turn into some of our quality control measures. The first one here is about continuous eligibility. So after eligibility is granted, if we made a mistake in that determination or there was some reason to suspect fraud, we can end eligibility even for those in a continuous eligibility status. We can still end date that eligibility. The only requirement is we have to provide timely notice, which means I can't, let's say you got eligible August 1st. And we identified either we were, reviewing a case to ensure our workers did it right, or there was some allegation of inappropriate activity. We went back in, let's say in November, and we looked at that case and we determined that, there was an agency error or fraud. We could end date them looking forward. So what we would do if it was November, we have to send them notice to tell them that we are ending their eligibility, and it would end at the end of November. So effective December 1, they would be off the program. So that does mean if they became eligible August 1st, they would have had coverage August, September, October, and November. The other thing I'll point out is we do have a PERM audit every 3 years in Kansas. I know there's been some references to a 2019 audit with a 27% error rate. I do want to point out, especially for those of you that have been in the legislature since 2017 and 2018, that audit covered that time frame when there was the well-documented clearinghouse backlog and all the issues with the clearinghouse that were occurring at the time. The legislature worked very closely with KDHE. That was when the decision was made to bring the quality and training programs and take them away from the contractor, put them back under KDHE. There was a decision to move long-term care and the elderly and disabled application processing to take it away from the vendor that was struggling and give it back to KDHE. So that was an anomaly. If you look at all of the other years, pre and post that, that is not a Kansas experience, but there is well-documented reasons why that occurred, and this legislative body helped us take a lot of actions to fix that. We did have another perm audit in 2022, and it did cover a little bit of pre-PHE, as well as some timelines during the public health emergency. I will point out about the perm audit, it is primarily focused on new applications. So the only thing the PHE did was put limits on renewals. We process new applications as we had since we started the Medicaid program back how many ever years ago. So the perm audit, while the number of reviews that would have been looked at in the perm audit would have been smaller because they would have been looking at the ones that we were able to electronically verify, it was predominantly new applications is what they looked at, which is also what they would have looked at in 2019. It's always predominantly new applications. So the error rate, because of a lot of the activities, did go from 27 down to 6.82% for Kansas. So again, the actions of this legislative body to allow us to take some of those drastic actions that we did in 2019, I think you're seeing the results. The national standard that CMS sets forth for states, they'd like states to be at 3% error rate, so we're still over that. But obviously substantial improvement over what was happening back in 2019. Additional activities that we do around quality control, we have, it's a perm, I always call it the perm-like audit. It's actually called MEQC. But the idea of MEQC is it is following all the perm standards. And this happens continually. Essentially, every year they'll be doing about 4 cycles of audits that mimic exactly what a perm audit would do, with the idea being that by the time a state gets to their next 3-year cycle, we're just getting ready to enter ours, then you will be prepared, if you will. You would have caught all your issues, you would have rectified those before you have the perm audit. And then, as I mentioned before, we moved our quality function back in-house after the clearinghouse issues, and that has shown good results. So there's always continuous quality control happening even outside of the perm audit cycle. The other thing that we've done internal to KDHE is we've increased our audits of our system functionality. The idea there being to identify any system issues very early so we can address them timely. You know, one of the things with Medicaid eligibility, because we have several 100,000 members on our rolls, if we have a system issue, it could impact individuals and their lives, but it also could impact the state financially pretty quickly, because one problem could impact thousands of members. So it's very important that we have these audit controls in place. I wanted to just point out a couple. The first one being that the transmed population, which is a transitional Medicaid population that we cover for 12 months, caught up in the annual renewal cycle. And so they just continued their eligibility. That issue was actually identified in 2019. A fix was ready to go in 2020, and then the public health emergency happened. So we had to wait until 2023 to actually implement that, but it went in April of last year. And there's more information about that in the Inspector General report. He did a report on the transmed. Again, this was one of the culprits of the reason for the overpayments, and again, this was really to show how quickly money can add up when you have a system issue. And then the other one that I want to point out is this is, again, when our Inspector General's office was of assistance to Medicaid, they had done an audit on deceased individuals, and through that audit, when they found some gaps, they were able to identify a system issue that was preventing an eligibility worker was going in and appropriately ending that eligibility for that individual because they were deceased, but the eligibility system wasn't feeding it over to our claims payment system, which is also the system that then sends information to the managed care organizations. And as a result of that audit, that issue was identified and fixed. So that really shows how the partnership between the Inspector General and Medicaid can work very well. The other thing we do outside of our audits for both individuals as well as the system, as well as partnering with the Inspector General's office, is we track any issues that are brought up to us by external parties. We have legislators that send us issues around eligibility, the governor's office, stakeholders, providers, the members themselves. We have a spreadsheet where we capture and we track all of that. What we're looking for is trends. Do we have a worker that is doing something wrong? Is the error always in this one area of eligibility processing where we can do a refresher training or whatever it might be needed there to, enhance our accuracy? So we take all the information, and the way I kind of look at it is we're always striving to get better. And Medicaid is a big and vast program, and if we need to take all the information from all the sources so we can do the improvements that we need. So with that, next slide, I think that is into my formal presentation. I will stand for questions.
Thank you, Director. I'm not sure which title to call you by,
You can
but
call me, yeah. I'll answer to anything.
you have a choice. Committee, does anyone have any questions? Go ahead, Representative Lewis.
Thank you, Chairwoman. Real quick, could you just describe with a little more detail what a caretaker adult is?
Yep. So it would be an adult that is either a parent or a legal guardian of a child, of a dependent. So I could not be, in Kansas, I could not be 27 with no child. I'm not disabled and I'm not pregnant. There's no way for me to become eligible for Medicaid. I would either have to be pregnant or have a child.
Thank you.
Go ahead, Representative Humphreys.
Thank you, Madam Chair. A couple of questions. The first one is, when you had mentioned that in the eligibility hierarchy, that I missed where that piece comes in, where you can kind of double check the TANF or the SNAP information.
Yep.
Was that between 3 and 4, or?
Yes, it's tier 3, where
It's part of tier 3.
Yeah, we would first try to do everything the other electronic sources, and the reason for that is that requires a worker to go in and do that research. So obviously, we're trying to do everything electronically before we would have a worker go in and try to look at some things on, the TANF and SNAP side of.
So do they have to give their permission?
Yeah.
For that worker to go in and look at their eligibility
We have
documents for TANF or SNAP?
Yeah, we have memorandums of understanding, and there's only, between the agencies, we have memorandums of understanding, but there's also only certain pieces of information that we can use. The thing to remember is SNAP and TANF have very different income guidelines and eligibility rules. So it's limited what we can use, but there are some things that, we can use. But again, it's pretty narrow. That's why it's tier 3, because I think a lot of people, and again, maybe even us on the state side would wish the programs would be more aligned, that there could be a lot more data sharing, because then if one side of the house has verified something, we could use it. But just because our rules are so different, it's pretty limited in how much we can use.
But the applicants don't have to give you permission, or they do not?
No.
Yeah, okay. Yep. Okay, and then also, I have the same question. Thank you, Representative Lewis, for asking that question. So the caretaker adult, is it the caretaker, I guess the financial requirements is what I'm trying to understand. So it's a child, because 60% of the recipients are children, but it's the parents who they live with. It's their financial, it's their finances that we're talking about.
Correct.
And so that's why if one of them is a caretaker. Now,
So what I'll point
Yeah.
out is there are different income thresholds. So in Kansas Medicaid, for a child to be eligible, they have to be 100% of the federal poverty level or below. For their caretaker to qualify for Medicaid, their standard is 38% of the federal poverty level. And that's why you see such a big range of difference of how many children we have on. And if you look at the caretaker number, it's significantly lower, but that's why, because it's a lot more stringent for an adult caretaker or parent, legal guardian. Caretaker is the kind of official CMS term, but I'll use the word parent. But it's very difficult for a parent to get on compared to their child because the threshold is so much lower.
There's times when the child is on, but not the parent.
And that's the most common scenario.
Okay, I see. And do you have a number of how many people we have on Medicaid right now? I mean, you said 60% were children, but I'm curious, what is that, the raw number?
And I will get that to you. It's on our CanCare website, but I believe we're at 460. Yvonne, do you remember? Are we 460? Yeah, I think it's around 462, but we'll get the official number. But we also have that's on our CanCare website. We publish reports every month, but we will confirm that number, but it's right around 462,000 is what I should say.
If I could just ask one last question. This is something I've wanted to ask for so long, and I'm so glad you're here. Elderly on Medicaid, like, explain to me the difference. I mean, Medicare is for over 65. Yes. And so can you explain Medicaid for elderly versus Medicare?
Yes, and there are a variety of programs, so I'll try to keep it high level. So how Medicaid interfaces with Medicare is related for the very low income elderly. And so if you are on Medicare, but you meet the Medicaid eligibility thresholds, you'll be eligible for both programs. So what will happen is, a great example is nursing home care. Nursing home care is not covered by Medicare except for, I think it's a 90-day rehabilitative stay. But if you're a permanent resident, Medicare does not cover that. If you're dually eligible and you've qualified for Medicaid, nursing home is a benefit under the Medicaid program. So then Medicaid would pay for your nursing home care. For other services where Medicare, like doctor's visits, we both cover doctor visits, Medicare is the first payer. Medicaid is always what they call the payer of last resort. And how that works is, let's say the Medicaid reimbursement for a particular doctor visit is $80. And you're also on Medicare, and Medicare pays $90. Medicaid will pay $0 because our threshold was 80 and Medicare covered 90, so it won't cover that differential. If the Medicare reimbursement is below the Medicaid, then we'll pay up to the Medicaid threshold. It gets very complicated. And then the other thing that you can have some limited, you can be qualified for Medicaid, not for full benefits, but for where we'll pay your Medicare premiums. We call them Quimby and Slimby, but we'll pay your Part A and B premiums. And so again, you don't meet the threshold to get full Medicaid benefits, but that's definitely a benefit to an elderly person to have their Medicare premiums paid for.
And just, that was so helpful.
Yes,
Thank you.
You're welcome.
And the elderly financial requirements, do you know what that is as far as the federal poverty level, or what percent or anything?
It's so the elderly, the asset is $2,000, which is a little bit higher than in our family medical side. So, but I'm trying to think of a very easy way to explain the elderly when we're getting into eligibility, because it's very different than family medical. So I'm trying to think of an easy way to describe it to you. Essentially, their asset limits, their limits are a little bit higher. They get some more disregards than some of our MAGI populations. Some of it will also depend if you have a spouse or not. But let me get with our eligibility folks, and we'll put together just a little fact sheet, because again, it's hard to explain. There's protected income amounts when you're talking elderly, and especially if you're in a nursing home, and it can quickly get.
That was super helpful.
Yep.
And if I just, one last thing, if I may. Thank you, Madam Chair. When you say resources, is that like assets? So, I mean, clearly if it's 2,000, like anyone who owns a home is it immediately.
That's where it can get very complicated, because there Again, the home, especially if you're looking at nursing home care, and you have a spouse, the spouse can stay in that home and that will not be counted towards your assets. That's why long-term care and you get into the elderly, it can get very complicated extremely quickly, which is why, too, it's very complicated for folks applying, because they might look at their neighbor and think, well, they got on Medicaid, and it seems like our circumstances are the same, but there's a lot of nuances to it. And even like when you talk burial plans, you could have a burial plan and I could, and I'm under the limit and you're over the limit, so mine doesn't count and yours does, and there's different types of burial plans. Is extremely complex, but let me see, and if we can get something just high level put together, just so it can kind of break all this out, because I'm obviously not doing a very good job off the top of my head of explaining it.
You did a great job. I really appreciate you answering all those questions. Thank you, Madam Chair.
Representative Wagner.
Thank you, Madam Chairman. Yeah, thank you for being here. It's a really a very good presentation. Did you watch our committee meeting 2 days ago? Did you see that? Okay. So the gentleman. I mean, of course, the topic was as far as Medicaid fraud and such, and the question being, I take it. I mean, one of his comments, and I would presume it's because he had the 2019 data about the 27%. Versus a 6.82, but 6.82 is actually the most recent data. Okay, so what is the national average? I mean, how does Kansas compare to other states?
National average in 2022 was around 10%, so we were actually good compared to the national average. I will say in 2019, when we had all of our issues, we were obviously above the national average.
If I may, so. You've had here in 2023 a very big unwinding of Medicaid. I mean, they added all these people during COVID, and then they were getting them off. It would seem that you have a pretty robust database to really. I mean, was that hard to do, or were you able to? Because of course, people who weren't eligible became eligible, and then of course then they became uneligible. I mean, to track who was who, was that hard or not?
Yeah, I mean, there was, in those very early months of the PHE when, there came all these new requirements about you could not, take people off the rolls. Yes, we had to make some pretty quick pivots in the system. I would call them more temporary workarounds. Obviously, we didn't change the system permanently because we knew at some point all of this was going to unwind. But yes, we had to make some really quick pivots to put some edits in the system that wouldn't allow someone to be disenrolled. When we ran renewals on a monthly basis, obviously we couldn't end date folks except for very narrow circumstances, so we had to have system edits built that wouldn't allow that. So yes, there was a lot of activity in that early part of the PHE in order to accommodate all the new rules.
If I may, Madam Chairman. So one of my questions on, Medicaid, the 38% criteria of the federal poverty level, is that their income from the prior year, from the prior quarter? I mean, how quickly does somebody become eligible? And on the flip side, how quickly do they become uneligible, if their income would, go up, like they get a steady job or something?
Yep. So when they apply, we're looking at the last 30 days. Yep. And so if they have to submit pay stubs to us, we're looking at the last 30 days. And again, depending when your pay cycle is, it may end up being that, your last two pay stubs actually put you at 45 days. But it's your most recent income, because to your point, I could have had a job 3 months ago and I switched jobs and I'm making a lot more money now, but I'm putting my old job on my application. I mean, I think that's rare, but could it happen? But that's why we also try to do the electronic matches, because that's going to be also your most recent income. But if we do require documentation, we require your most recent pay stubs in order to verify your income.
One final question. So how quickly would you, I mean, I would think, just stereotypical, middle income folks, I mean, all their data, would be kind of online. I would think people a little more down below the poverty level, a lot of the stuff is not really accessible. I mean, do you have a problem with that? I mean, can you actually find electronic data on people? I mean, is that still very common that you really can legitimately qualify or disqualify people at that level?
So so also one other thing I want to make, again, it's called ex parte, but that's our process where we're doing all these matches. There is more to eligibility, obviously, than just income. But that's the first thing that we look at. So right now, when we run our process, about 70%, it ranges from 68 to 72% of our folks applying or renewing have an income record. So they have some level of income. That's about our match rate. But there's a provision called reasonable compatibility. So for instance, if you put on your application that I make $5,000, and we get an income match back from our electronic sources that say you make $10,000. That's well outside of reasonable compatibility. That would then generate us sending a notice. But there's other things that we're going to look at. We're going to look at household composition. Some of that comes from the federal hub, residency, citizenship. So you could even, on the income side, we could get a good match. But there's something else in that cycle that raises a red flag that says, this is not a real solid match. We're going to need to basically drop that out and make it go the worker route.
Representative Myers, sorry.
Thank you, Madam Chair. Thank you so much for being here. I just have to share with the committee what she is presenting to us now. It took me, I would say, at least 5-10 years to learn, and when I was practicing, and it changes all the time. So I really appreciate the great high-level presentation you're doing. It's wonderful. I only have one question for you, which surprises everyone, I'm sure. So I wanted to ask you to clarify a little bit about the disabled per SSA requirements eligibility criteria. I understand through speaking with a lot of my colleagues on both sides of the aisle that there is some confusion about who is qualified under that and what that means. And I think I've made points in the past about the gap really does truly affect individuals who are disabled but are not qualified for disability. Could you speak to us a little bit about what the process of applying for disability involves, if you know about how long it takes to get through to the end and things of that?
So I'll approach it from our perspective of it, because again, obviously Social Security does that permanent disability, but in Kansas we do have a process. It's called presumptive disability. So if you've gone and applied to Social Security, because it can take time for that decision to be rendered, you can also, it's very similar documentation that you can submit to us. It will be reviewed, and we have a checklist of what Social Security considers. And if we think that you meet the criteria, we will temporarily grant you eligibility. But there's also a cutoff, because if that decision doesn't come in, we're going to end date you. But yes, there is a process. And again, it's evaluated as if we're kind of acting as if we're Social Security, to try to shorten that gap for members, because, and it's better now, but during the PHE, obviously the lag time there, I had heard, had gotten quite, lengthy from Social Security. But you bring up a really good point. Someone could be disabled. They don't meet the Social Security requirements, and unless they qualify for HCBS or one of our waivers, or somehow have that other avenue just from a regular Medicaid perspective, they would not qualify unless they qualify for a waiver.
Small follow-up. Could you explain approximately how long does that temporary Medicaid usually last for an individual who's waiting on the determination from Social Security?
I may have to get back to you if that's 90 days or if it's 6 months. I think it's 90 days but let me verify. But it is time limited before we have to have a decision.
And so typically, in my experience, and this could have changed recently, but it can take up to 24 months in some cases to get that determination. Would that be fair to say?
It could be, yes, yes. And then and again, there are some avenues that, they can provide us a documentation that it's still under review. But there's triggers where we would be asking for that verification. Because what you don't want to have happen is someone's done the PMDD process and then they've stopped following through with Social Security. That's what we're trying to avoid there, that we want to extend the coverage for someone who obviously has some challenges, but we want to be sure they're following through with the Social Security process. So again, there are avenues to continue it beyond that, but there's points where we're going to start asking questions.
Representative Hoagland, you get the final question.
Yay, thank you. On these eligibility criteria on page 4, are those federal or are those simply Kansas?
Those are federal.
Okay, so the fact that you need to be a U.S. citizen to get Medicaid is a federal policy.
There's a federal citizenship or an immigration policy, and there are some folks who are here legally, but not all folks, and even citizenship. I always hate to say this because I sound like a broken record, but Medicaid is, the rules are very complex. But you have to be a U.S. citizen. If you are not a U.S. citizen, you have to meet particular immigration statuses that would allow you to be eligible. Some immigrants could be here legally and have a 5-year wait period before they're eligible for Medicaid. Some statuses will allow you're here legally and you immediately get on. If you are not in the United States legally, the only option for you, and this is more of a protection for really for the providers, if you present to an emergency room, you can get what we call SOBR coverage, and that will pay to stabilize the patient for the emergency services only. So it's a very restrictive, but otherwise, if you do not meet those citizen and immigration criteria, then you're not eligible.
Okay, so we've just debunked the whole everybody's coming here to get our Medicare and Medicaid.
I will tell you, this is what state by state, I do know that some states, I know California, for example, has some state-funded only programs that will provide Medicaid lookalike coverage to undocumented immigrants. So again, every state, that's why I always say every state is so different and it's hard to make generalizations. But yes, there are some states that do state-funded only programs for those outside of the citizenship and immigration criteria.
Representative Lewis, really quick. We still have 2 more presenters, so.
Yes.
Misunderstood something. I thought when you presented before questioning, you said that the national average error rate was 3%, and Representative Wagner was asking, you said it was 10%.
So 3% is the CMS standard. So when they come out and conduct a perm audit, for a state not to be subject to any federal owing the federal government back any money, their threshold is 3% or 97% accuracy. Anytime that you're outside of that, then you're subject to a potential payback of federal dollars. The national average of how states do on their audits is like 10.5 or 10 point, from the 2022 perm cycle. Yep. Sorry if I wasn't clear on that. All right.
Thank you so much.
Thank you.
All right, and committee, next up, we have Mark Altenburnt, which is DCF General Counsel.
Good afternoon, everyone. Again, my name is Mark Altenburnt. I am the General Counsel for the Kansas Department for Children and Families, and along with a lot of assistance from the Director of EES, Carla Whiteside-Hicks. I'm here to present on public assistance, verification, and fraud prevention. We provided slides, and I'd like to start on page 4, if I could. Just kind of as a brief, I guess, explanation of how DCF is organized. You've got there's DCF's major programs, Collaborate for Family and Individual Outcome Achievement. These programs are supported by core operations, and the program and practice are carried out by teams in 36 service centers across 6 regional offices. As you can see by the design here, you've got the central administration in the middle, and then you have various programs that are connected to it. Specifically here today, we're talking about Economic and Employment Services, which is at the top. Next slide. Again, the Director of the Economic and Employment Services is Carla Whiteside-Hicks, who is here with me today. The EES, as we call it, it provides a variety of programs that can help families achieve self-sufficiency, and these include cash assistance, which is known as Temporary Assistance for Needy Families, or TANF, food assistance, such as the Supplemental Nutrition Assistance Program, which is known as SNAP, child care subsidies, employment assistance, and energy assistance. Next slide. Getting into the EES application process, the application submission and eligibility determination, basically what this is a bullet point of methods that can be used to apply and also to help us determine eligibility. So such as online, face-to-face, fax, email, drop it off at an office, postal mail, other agencies, and Amazon Connect/phone. So in terms of information verification, we could roll over to page 8. In July of 2015, Kansas rolled out a modern eligibility system called the Kansas Eligibility Enforcement System, or KEYS. The initial rollout concerned only medical programs and used web services and batch interfaces to access income information to be used within the system to determine medical assistance eligibility. Next slide, if we could. Thank you. In terms of verifying assistance eligibility, there's various types of information that we verify that assists us in determining whether somebody is eligible. These include identity of each adult in the mandatory filing unit, gross non-exempt income for each adult in the mandatory filing unit, disability, resources, United States citizenship or non-citizenship status, Social Security numbers, relationship to the children on file, and cooperation with additional programs such as child support services. We use a variety of eligibility interfaces, and this again helps us to verify information. There's a whole list of them on the next 2 pages, such as LexisNexis, the work number /TALX, which we'll talk about in a minute, Social Security system, public assistance reporting system, information system called PARIS, systematic alien verification for entitlements, which is called SAVE. And as you can see on the page, all of these interfaces are used at different times, and those are noted here, such as the Internal Revenue Service that uses TANF, which is checked monthly, Kansas Lottery is checked monthly, et cetera. Moving on to the next page, we also utilize a variety of different agencies to verify data. Those agencies are listed here, such as the Department of Commerce, Vital Statistics, and Child Support Services. You probably don't need me to run down the entire list, so you can look at it. But we use quite a few interfaces. In terms of EES data exchanges, again, this is more information regarding verification of information. So when data is received through an automated process, such as SSA or KEYS, KEYS creates a task for eligibility staff to take action. Information received via email, also such as the Kansas Lottery, is manually matched to assistance recipients, and out-of-state EBT usage is tracked by FIS. FIS is our EBT vendor, and communicated then to EBT. The next slide concerns the TALX Corporation, who I referred to briefly previously. KDHE contracted with Equifax subsidiary Talix Corporation to provide necessary services. These services were later extended to all non-medical programs within DCF, such as PPS, CSS, EES, and VR, for purposes of employment and wage verification. As part of that verification, Talix checks the following information for each applicant: employer name, employment status, employer address, employment dates, position title, medical and dental information, if available, pay rate, pay period, and pay dates. Page 14 indicates or provides additional verification. Our fraud group supplements Talix with the CLEAR software database from Thomson Reuters, which pulls information from one of the 3 credit agencies. In addition, our EBT manager has access to some analytic information from our EBT vendor, FIS. The data generated is verifiable data based on the cases and complaints that our investigators have entered into our database. Potential fraud is most frequently brought to the attention via the fraud hotline. Our investigators then investigate the potential fraud and review the matter to hearing or criminal prosecution if appropriate. The next topic that I'll discuss is specifically our fraud investigation unit, which is located in the Office of General Counsel. The mission of the Fraud Investigations Unit is to aggressively investigate, detect, prevent, and prosecute welfare recipient fraud in all public assistance programs administered by the Department for Children and Families, including TANF/cash assistance, food assistance, child care subsidy, medical assistance, and energy/LEAP assistance. The Fraud Investigations Unit at DCF is comprised of a chief investigator, 2 deputy chief investigators, and a fraud hotline receptionist located in the Office of General Counsel. We also have 14 fraud special investigators and 4 benefits eligibility experts assigned statewide. If someone were to suspect that a person is receiving public assistance to which they are not as entitled, we have a hotline, which is the DCF fraud hotline listed at the bottom. What happens next when fraud is detected? On page 17, it indicates allegation of fraud are either usually from the fraud hotline or provided by EES. Each referral is entered into the fraud tracking database and assigned to a special investigator. Hotlines are sent to EES to determine relevancy. If relevant, the case is turned over then to the special investigator. Depending upon the allegation, different investigative techniques may be used. Case records, such as applications, interim reports, and case notes are reviewed, along with a review of the benefits issued and used. Various database checks are conducted, such as CLEAR, district court records, employment records, address histories, school records, and bank records. Once the special investigator has proof that fraud has been committed, they staff the case with one of the 4 fraud analysts who will advise of the various potential program violations. Depending on the dollar amount, if there has been past fraud or blatant or how blatant or egregious the case may be, a decision is made as to how to best adjudicate the case to receive a finding of fraud, and it may be referred by the investigator to the appropriate district or county attorney for criminal prosecution. It should be noted that waivers and administrative hearings are the method preferred by the USDA. They are also less time-consuming. The client is then contacted by the SI for an interview to verify various pieces of information. With respect to the waivers and administrative hearings that I just referred to, if information is conclusive, the SI will provide the client an opportunity to voluntarily sign a federal waiver form where they accept the fraud penalty and repayment of any overpayment. If the client prefers a hearing, the case is then presented to an administrative law judge for an administrative fraud finding. In terms of fraud investigation results, we've provided some numbers here at the end in a table which you may find useful. On page 20, we've broken down the last 3 fiscal years. The average total of assistance cases has stayed relatively stable, 143,000 to 145,000. Total referrals are there. Non-findings of fraud or a finding of no fraud, those are listed right there. And then findings of fraud, which is just a math problem at that point, are listed on the last column. The next page refers to fraud case action. Again, the three prior fiscal years are broken down. We had the number of cases referred for hearing, and then we had the claims activated as fraud. When we say that we activate them as fraud, this is a formal entry in the EES system identifying that there's been a formal finding of fraud. The next page, fraud claim collections by fiscal year. Again, we break down the last 3 fiscal years. We have the total owed there. We have the total amount recovered. And then the result of that math problem is the remaining balance owed. Are there any questions from anyone?
Representative Roth.
On that last slide on the collections by fiscal year, so is that, are those just rolled forward when they're not collected into the next fiscal year?
Yeah.
To that fiscal year, or is there a larger number that these come from?
Well, I believe they're rolled forward, yeah.
So like in 21, total owed was only 822,000. Round number.
Correct.
Yeah, and then you recovered 275,000. So
Correct.
547 was then owed to an amount that was.
It's then rolled into the subsequent year, correct? Correct.
Okay, all right, thank you.
Representative Hoagland.
Thank you. How did Amazon get in here?
I'll leave that specific program question to Carla to answer.
Carla Whiteside-Hicks, Director of Economic and Employment Services for DCF. When we shifted to telework for our eligibility workers at the beginning of the pandemic, we started using Amazon Connect as a way for eligibility workers to telework, yet still be able to contact applicants or recipients of our benefits by phone. So that's the way they can do that through their laptop, their state-issued laptop, and so they're not using their own personal phone for that service.
Representative Carr.
Thank you, Madam Chair. Just a brief question. How long have you been at this? What's your experience like?
I've been at DCF for a little over 3 years at this point. I've been general counsel for the last 2.
And is this generally your background? Is this what you've done historically, or is this like a new endeavor?
Fraud investigation?
Yes.
I've dealt with it a little bit in private practice, but on a government level, yeah, this would be a new endeavor.
So, just in your opinion, how effective is this? Would you say it's the investigations, are they effective? Are the things completely out of line?
Well, in terms of my opinion, we're happy to provide specific figures. That would probably be more helpful than what my opinion is. I have a high opinion of my investigative group, and I think they do a good job. And I know that as an agency, we try very hard to combat fraud, and we are good stewards of the public's money. But in terms of an answer to your question, that would probably be more appropriate than my opinion. We can provide specific figures, how we compare it statewide versus nationally, for example. We can provide that sort of information to you.
I'd be interested in that.
Certainly.
Thank you.
Representative Humphreys.
I didn't think I raised my hand, but of course. So just, I think it's very quick. EBT stands for what? I couldn't find it anywhere in here.
Oh, it's, yeah, electronic benefit transfer.
Okay, so that's what I wondered. So I wondered if that's what it was, because you have an EBT manager, it looks like. This is from slide 14, and has access to analytical information. So these are people's, I mean, is it on your end, like you're looking at transactions from your end, or people's?
You mean, are we tracking transactions with the EBT card? Is that the question? Carla would have a better answer than I would.
So yes and no. We are flagged, for example, for out-of-state usage. We get a notice. If you are continually using your card in Missouri, that's flagged. We will know, but then we're going to investigate. And so we see you're living in one of those border counties in Kansas, and the closest grocery store really is in Missouri. So we're fine with that. But so that's the only tracking that we do with that. We're simply looking at the data that is provided to us.
That makes sense. Thank you. And then I did have a question from Representative Roth's. A question about if that's rolled over. I mean, the numbers are really, this is slide number 22, if that's important. But the numbers are just really curious to me, that like what was rolled over from 21 to 22 is like 893,000. And then, but what was rolled over from 22 to 23 was, 76,000. Sure. So like, was there just a vast decrease in the fraud, or like those numbers aren't making sense to me?
Well, without trying to get into what the possible reason is, I think the easiest way to say it is we can provide a detailed account as to how much specifically is rolled over, and that may provide a better idea than just these numbers. These are general figures, but they are rolled over, but we can provide you a more detailed breakdown.
Okay, yeah, because that just kind of wasn't computing. So I guess that'd be great.
Sure.
Just to make sure that we understand. Thank you. Thank you, Madam Chair.
Representative Myers.
Thank you, Madam Chair. Thank you for being here. I totally get what you're saying. I was looking at the percentages here, and it looks like it has decreased pretty significantly, so that might be part of it. I'm not the greatest at math, so I used a percentage calculator on my phone. But it looks like in 2021, there was only 0.216% fraud found. In 2022, there was 0.231%, and then in 2023, there was only 0.156%. So this is a fraction of a percent, and I think that might be reflected in how the rollover amounts work. That's just kind of what I was thinking, so I wanted to share that. Thank you.
Representative Roth.
Well, I was thinking about that. Thank you, Representative Humphreys, for asking that question. But what I think is there's ongoing investigations, and when there's something found and owed, then that's added to that for
Yes.
the fiscal year. And so then that compounds what the addition and subtraction is taking place here, would be my opinion. Thank you, Chair.
Representative Droege.
Thank you, Madam. I think I've mostly my question's been answered. I guess it comes down to how much fraud's been found and how much has been collected for, instead of just rollover and everything. Just what's the effectiveness, and is it, we getting a bang for our buck for hunting fraud? But I'm sure that you'll have to.
Well, I think again, I'm going to have to probably give the same answer. We can get much more detailed breakdowns for all of you than what is the general figures that are in here. I do think we're getting bang for the buck, but again, that's just my opinion based on what I've seen. But in terms of numbers, we can get you any of that information that you would find useful.
Thank you. I'd like to see that.
Sure.
Just real quickly, I had a question kind of on that same topic. Do you happen to know, are we required by the federal government to have a fraud investigation service in our state to investigate?
I have a thought on it, but
We're not required to have a specific fraud unit, but we are monitored for each of our assistance programs. And part of that monitoring process is that particular federal agency, if it's Office of Child Care or if it's FNS, how are we ensuring the integrity of the program? And so in each of those state plans, you would find Mark's team, his investigative team, as what my team is saying, this is how we are ensuring the integrity, or working to ensure the integrity of the program.
Thank you so much. This is just my own opinion, so I'll keep it super short. I think that the voters of our state do actually want us to have some systems in place to prevent fraud and the ability to investigate fraud, especially when they may be the ones calling in to file a complaint of suspected fraud. So sometimes I think that's important to remember, is what is the voters' expectations of us. So, if we are ready, I would like to go ahead and move on to you do one more? Okay, really quick. I'll let you, Representative Myers.
I'm sorry, you made me think about it. Thank you, Madam Chair. Okay, so on that fraud section, I was just reflecting on the presentation we had on Tuesday, and then some of what our other committees said. In those numbers, are those individual recipients or are retailers included in those fraud numbers?
oh, we're not sure, but we can get that information for you.
Okay, great, thank you.
Certainly.
All right, thank you so very much.
Very
Appreciate
welcome.
you. All right, and next up we have Steve Anderson, the Medicaid Inspector General, presenting to us.
Madam Chair, members of the committee, thank you for the opportunity to come and speak with you today, provide testimony about Medicaid as well as public assistance fraud. My name is Steve Anderson, Medicaid Inspector General. I'm happy to present this information. I understand we're under a little bit of a time crunch. If that's the case, rather than beat you up by reading all 14 pages to you, I can give you just a quick overview of a few things, then stand for questions if that would be your preference.
That would be just fine.
Okay. Let me just give a little background, because I know Representative Carr asked that earlier. I have 25 years of federal law enforcement experience conducting fraud investigations at the IG level. Then I had 5 years with the Medicaid Fraud and Abuse Division within the Attorney General's office, and I've been in this current position now for about 2.5 years. So long experience doing fraud investigations. I also want to emphasize that the fact that the Medicaid Inspector General's office really didn't exist until just a few years ago. We had a IG that was temporarily in the position for about 1.5 years. That was Sarah Fertig. When I was appointed and approved by the Senate, I started in April the 6th, 2021. At the time, I had 1 auditor and 1 analyst. We've since grown. We're up to 9 FTEs now. So I have 2 special agents who started 7 months ago. I have 3 auditors, 2 analysts, a part-time secretary, and myself. So we are a small office doing big things. One of the questions that was asked was about the audits that we have performed. I do want to address that. This past year, we conducted 3 audits and issued 1 interim audit report. In calendar year 22, we did 1 audit report, and in 21, we did 3 reviews. Part of that results from that is we identified over $211 million in overspending, or wasteful spending rather, over $6 million in overpayments. Over $12 million in potential savings were identified, 19 findings were identified, as well as 64 recommendations made. All that information is available on our website that's listed there. We issued several of those reports. I do want to commend KDHE's leadership. They've been very gracious in working with us when we identified problems. They work with us well, and I do appreciate that a lot. I do want to get back to very far back in here and talk about our cases that we identified, because one of the topics they were wanting us to talk about was that. Again, we did not have investigative staff until July of 2023. We currently have 2 special agents and a financial analyst dedicated to conducting eligibility fraud investigations. And to that point, prior to then, there was nobody conducting eligibility investigations in the state of Kansas for Medicaid fraud. Okay? I'm sure I'll get questions about that, but I want that to soak in a little bit. Since then, we've opened 186 cases for investigation. We've closed 67 for various reasons. One resulted in a prosecution that resulted in a diversion agreement with restitution. 2 additional cases have been referred for prosecution, and numerous others have been referred to other agencies. 13 of the cases that we closed were closed due to the allegation being disproven. Oftentimes, people look upon that as not being a valid statistic or, well, nothing happened. For the people who were alleged to have committed the crime, that's a very successful investigation whenever your allegation against you has been disproven. So it means a lot that that happens. We're also conducting joint investigations, and for the record, we currently have 45 cases that have a DCF component involved in it. We're working with the DCF investigators, because oftentimes if somebody's committing DCF level frauds like food assistance fraud, SNAP, that sort of thing, they're also committing Medicaid fraud, eligibility-wise. So there's a certain pairing that goes on between our 2 agencies for the type of things that we might be interested in looking at. I want to give you a few examples of some cases that we currently have under investigation. We have a medical ID theft matter that was recently referred to us. The individual was contacted their doctor about medication that was being prescribed for them and said, you know, this doesn't make sense. Why are you doing this? Also, the pharmacy contacted her and said, this drug you're taking, there's, you know, interactions with it that don't make sense. Also, she was notified that she'd been approved for rent supports and what have you from the Council on Aging. And she said, none of that applies to me. I didn't put in for that. I'm on my own home. I'm fine. She contacted the local police. They said, listen, we only have 1 part-time officer. We really can't help you. Call the fraud hotline, talk to Medicaid. So that's how we ended up getting it. We're happy, obviously, to help with that. But Medicaid ID theft is a real thing. People use Medicaid IDs to get services and what have you. But the problem with that is if you're using somebody else's medical information and you go in and representing that, your medical conditions get overlaid on top of theirs. And that's a serious problem. We also had a case that was referred to us involving a false pregnancy. And as you've heard from other testimony, they had to take basically what somebody says at their word. This young woman purported that she was pregnant in order to get Medicaid. She also got food assistance by lying about being that way. But DCF asked her to provide proof of her pregnancy, so she provided a falsified letter, forged a doctor's signature to get approved for this. She would not have been eligible for Medicaid otherwise. She had attempted to get Medicaid prior to the false pregnancy claim and was denied because she's a healthy young woman and she didn't need to be on there. So that case has been referred for prosecution. And then the last one I want to mention, in this case, is the one that resulted in the diversion agreement, had an individual who, when she was asked about her income and eligibility and household composition, she said that the father of her 4 children did not live in the house. She didn't know where he worked, didn't know where he's at, didn't know how to get hold of him. In fact, he was there every night. In fact, he was a police officer in a local community. She was qualified for caretaker medical and got benefits for herself as well as her kids. Her kids would have qualified for CHIP anyway, but she didn't qualify, and so she got medical coverage and she didn't have. Plus, they got food assistance they weren't entitled to. And the resulting harm to the state of Kansas for that was over $43,000 in capitation payments that were made on her benefit to the managed care organizations. And the food assistance fraud that she got was over $27,000 in food assistance that she was not entitled to. If she had been truthful about her income and household comp, she would have never got any of those things. We were asked to address agency policies and procedures. Obviously, we've talked about that. 19 findings and 64 recommendations were made. And again, KDHE leadership's been very cooperative. We've also dealt with KDADs. And then I think the last thing the chairman had asked for me to talk about was the number of complaints and what have you. In calendar year 2023, our office processed 1,447 complaints, with 1,339 of those being eligibility complaints, which is a lot. Those primarily come from DCF, but we also get complaints from private citizens, other law enforcement, what have you. And quite a few of those end up being pushed on to the clearinghouse for processing. And some of them, like 38 of them, after we reviewed them internally, we found there's no Medicaid issue at all. The person who was making the allegation was mistaken. We were able to clear it, and we were able to close it right out like that. And so on the last page, there's a chart that breaks down how we handle the case as far as the number we screened, ones that were sent for review. Like, for example, we had 191 that were closed for no fraud or jurisdiction for our office. We opened 112 cases, and 70 were referred to other agencies like SSA-OIG, HHS-OIG. After breezing through that very quickly, I'd be more than happy to answer any question you may have.
Thank you so much for that brief overview. I will warn you, it is possible the chair might call you back later, but I'm just, I'm doing my best here to wing
I'd
it.
be delighted. I would be delighted.
Anybody on the committee? Representative Lewis.
Thank you, Madam Chair, and thank you for your presentation. From your perspective, as head of the Inspector General's group, do you have the resources you need?
No. We need more resources. 2 special agents isn't nearly enough. We got what we could last year with getting those 2 agents and then the financial analyst, but we could certainly use more resources. By virtue, you look at the number of the complaints we get, we would open even more cases than we do if we just had the resources to investigate them.
Go ahead, Representative Humphrey.
Thank you. Thank you, Madam Chair. Thanks. Just a quick question on, I noticed there's a little section in here about fingerprinting.
Yes.
And just, with school districts and fingerprinting. But I'm just curious, I had heard that what happened with our courts, the whole system, that was hacked into and everything and shut down. Did that affect your ability to do fingerprint checks? Because I had heard it did, but I don't.
No, it had nothing to do with this. The bit in here about fingerprint checks is we issued an interim report on that, is school districts have employees who work for them. They don't do fingerprint-based records checks on at all. And these are people who have one-on-one contact with students, social workers, speech therapists, coaches, people like that. And we recommended that perhaps they should. We even found that teachers only undergo a records check when they're recertified, so it's potential that somebody could go for a lengthy period without having a fingerprint-based records check. Name-based records checks really are not terribly effective. If you have a common name like I have, it's not very effective. And you really need to do those fingerprint ones so that you get a nationwide search rather than just a within the state of Kansas search.
So are they doing, the teachers are doing the name-based ones, just not the fingerprint ones?
The teachers, from what I've been told, are doing them on certification, so they can go for years without being checked. And then they're tied into the system with the KBI right now, so that if that teacher was to commit a crime within the state of Kansas, they would be notified. However, if they commit that crime in any other state in the nation, they would not be notified.
I think there's a bill out there to work on that.
I think so, too.
Thank you.
Thank you, ma'am.
Representative Meyer.
Thank you, Madam Chair. Okay, just a couple questions. So first, I am trying to follow here. I'm looking on page 9 of 14, talking about closed cases and investigative staff, and then I'm comparing that with the final page. So the findings of fraud and fraud investigations to date. So I see here as of, I don't see a date necessarily, but it says something about 67 closed cases, 13 were closed, so on and so forth. Then it says 43 referred to other agencies. Am I to understand that if they are referred to other agencies and they are still being investigated for potential fraud, or they are found to have had fraud and you're, working with the other agencies to?
No, those 43 were referred because we have no investigative interest. It may not involve Medicaid at all. It may involve Social Security only, or it may involve Medicare. and so that they're able to look at that. So we send it on to agencies that are better situated. And again, at the time some of these referrals are made, I didn't have investigative staff to even look at them. So we tried to move them on to people who could do something with them. We're being more aggressive now that we have the staff members. And to that end too, and we're trying to get our footprint expanded and take it where we're no longer the Medicaid IG, but rather the Healthcare Inspector General's office, to allow us to look at healthcare fraud, so we could look at Medicare cases and look at other healthcare concerns, because right now our hands are very tied, being solely limited to looking at Medicaid issues.
Okay. So could you tell me, maybe we just went through this a little too quickly and I missed it, but could you tell me how many cases of fraud you found that were substantiated within the last, let's say just 2023, if you have that?
Well, since
Or if you can-
2023, right now, we had one that was prosecuted, two that have been referred for prosecution. So we're waiting on basically make its way through the court system, and we all know that can take a while, right? And then the others are in various stages of completion, because we've only been doing this for 7 months. So it takes a while, okay? Yeah, I'll have much better information next year, maybe when I get to talk to you again.
No, I understand. I'm just trying to figure out, so like with what we did with the previous discussion about fraud, I'm trying to find the percentage. And I understand that you do need more help in order to investigate more cases. But I'm just trying to sort this out here for myself, because from what I can tell, this is, I mean, well below 0.1% of the Medicaid population, if we're talking only beneficiaries, are committing any sort of Medicaid fraud. Now, if we're talking about providers, I'm not seeing those numbers here.
I didn't break them out.
Oh, that's okay.
About 8 of our open investigations involve providers.
No, I understand. So from what I understand from those I've spoken with in the field, most of the fraud that occurs with Medicaid does occur on the provider side, whether it's intentional fraud, or if it's a paperwork issue, so that's not even fraudulent, or if there's something with a billing and coding error, which frequently happens. But that's where a lot of the issues come from, is that side. And so from what I'm seeing here from the beneficiary side, if I'm correct in the numbers that you're giving me, I mean, we aren't even, like if you're saying it's about a handful, probably, so far within 10 months, you'd say maybe about 10 successful, for beneficiaries.
Well, beneficiaries, right now we have, what did I have in here? 116 cases or something opened. Let's see. 112 cases have been opened. And so, again, resources limited. I think some of those, obviously, when we go through them and we investigate them, some of them don't result in a prosecution because maybe there's not enough evidence to support a prosecution, or we find out after a thorough investigation there's not anything to it and they end up being closed because the allegation is disproven. But it's really premature for us to make any decisions based upon the amount of percentage. I will say that getting the number of complaints, if you look at that, every year has gone up. And part of that is because people are better able to identify things. We've been doing outreach. We've been doing fraud, waste, and abuse training. One of the things we had identified in one of our early audit reports, that when you called the clearinghouse and asked for the phone number, first off, there was no number. And if you did talk to a live human being, over half the time they'd give you the wrong number to call to report fraud. We got that fixed. One of the first things I did when I became the IG was getting that fixed. So now when people call the clearinghouse and say, I want to report fraud, they're giving the correct number, which is, by the way, the DCF hotline, and the DCF people then send it to us. So I think that's one of the reasons we're seeing an increase in fraud referrals, is because people actually can get to the right people now.
Sure, I understand that.
And something that's not reported on here too is the Medicaid Fraud and Abuse Division, where I used to work. They've got several hundred cases open involving PCA frauds, or direct support worker frauds. So that's another area where we see a lot of fraud in the Medicaid arena.
Yeah, I would consider those providers, but as far as beneficiaries go, so when you are saying that you're receiving complaints of fraud against beneficiaries who are receiving Medicaid benefits, where are those complaints coming from? Who are they coming from?
Sure. A lot of them come from private citizens who know something about the individual. A lot, it's neighbors, relatives. Oftentimes, it may be somebody who was formerly part of the family. We sometimes talk about the fact that when a couple's together, then the love exits the relationship. The first thing they want to do is call and report you for some crime. So we get a lot of those. But they come usually from private citizens, but they come through the hotline to us. So that's a little bit of misleading in that they come from it. But also they come from the DCF investigators, because when they're looking at somebody for food assistance fraud and they look at the program and they realize, hey, this person's doing this, we opened up some channels of communication over the past several months where we're starting to get some referrals from them. And they're good referrals, because if somebody's, clearly provided false information for food assistance, they're pretty much usually also committing Medicaid fraud.
I just want to close with this. So, my concern and my line of questioning is because I really, once again, I want to emphasize that I do not believe that beneficiaries are the primary instigators of Medicaid fraud. I do think that it mostly occurs on the provider side for the reasons I mentioned before. And having been in the social services field and working with survivors of intimate partner violence, other forms of abuse like elder abuse and things like that, it often occurs that somebody will get reported for misusing their benefits as a punishment because they're no longer able to receive benefits on behalf of that recipient. Do you know what I'm saying?
I do.
So, I want to point out that I appreciate the work that you're doing, but so far, based on the information you've given us, it looks like there is approximately 0.002% happening at the beneficiary level. So, thank you.
Thank you.
Thank you so much for being here and presenting, and it's very interesting. I'm going to read your testimony more carefully again. And thank you for that. And committee, we're going to go ahead and close for today. I did want to just let you know, the chair wanted me to let you know that next week we will have committee both Tuesday and Thursday. And Tuesday, right now, the plan is for the homeless video that he's previously referred to and a presentation with that. And then Thursday will be a hearing on the rewrite of the welfare statute bill, which I don't think has a number correct yet, right? Okay, good, because I couldn't find it in my notes, so I was hoping I didn't make a mistake. All right, so with that, we are done. Thank you, guys.